All right, welcome everybody. My name is Tony Jackson. I'm the president of Westside Legends. And tonight, Westside Wellness has a special feature. It's going to share some information that could save your life. And we're very, very proud to be teamed up with BHS. And we have a special guest with us tonight. And it's not a guest, that just is an expert on this subject and is going to bring some more to this. And we can't wait to share this information. So please welcome, with a Westside welcome, Dr. Bratcher. How are you, Doc?
Thank you so much, Tony. I really appreciate being here. It's a pleasure. It's my honor to be here and try to spread some information about why it's important to get screened for colon cancer. March is Colon Cancer Awareness Month, so now is a perfect time to talk about it. So I'm going to show you a few slides that discuss, some of the points that we really want to stress to everybody about colon cancer. All right. So 5 things that you need to know about colon cancer. It's going to be short and sweet. So the first thing, polyps are the pieces of tissue that develop in your colon that could turn to a cancer. So your colon, it's also called the large intestine, can develop polyps that turn to cancer over time. This is just a little cartoon that shows where your colon is. If you didn't know, it's all the way down, kind of big question mark shaped organ in your abdomen. And this is what polyps look like over time. So you start with these little tiny bumps in the wall of the colon that start getting bigger and bigger, and then they turn into a cancer and then go through the wall of the colon. So our goal is to try to get them off here before they start getting worse. So the second thing that's very important to address are symptoms. So most people don't realize that the vast majority of people who have colon cancer actually have no symptoms. That's why it's very important to get screened. If you do have symptoms, however, they can include rectal bleeding or seeing blood in the stool, change in bowel function, where if you normally had bowel movements every day, you have fewer bowel movements or they're different, or what we call pencil thin. Unexplained weight loss is also another big thing that could go along with colon cancer, and new onset constipation or diarrhea. If you develop any of these things, it's very important that you talk to your doctor to determine if you need further workup. But again, most people with colon cancer don't have symptoms. We find it incidentally on a colonoscopy. The third thing is screening. The most important thing, other than showing up to talk to your doctor, is screening. So everybody hears about colonoscopy. So it's important to know that screening colonoscopy is safe, effective, and it allows us to remove polyps before they turn into a cancer. The procedure itself, it's an outpatient, same-day procedure. You'll have to do a preparation the night before to clean you out, which everybody dreads, but it's not that bad. And then we have anesthesia to put you to sleep so you don't feel anything. You have a very, very, very good nap. So colonoscopy is the gold standard. It's the recommended first-line test. We recommend doing it every 10 years unless you're high risk or inner polyp seen. Then if you have polyps, then we recommend every 3, 5, or 7 years. There's also stool-based testing. These are, in some patients, they prefer this because it's easy. In some of them we do yearly, called the FIT test. Some of them are every 3 years, as you probably have heard, the Cologuard. The issue with these is that it's not great for early polyps. So we may not see polyps in the very early stage that we can get them off more easily. And then there's virtual colonoscopy, which is a CT scan of the colon. It's diagnostic. It can't remove the polyps, however. So you'd still have to end up getting a colonoscopy anyway. And then risk factors. It's important to understand your risk of developing colon cancer. Certain things can increase your risk. Age, as we get older, we know that the risk for polyps increases as we get older. It's about 4% in the 20 to 30s, up to 30% at the age of 50, and half of patients age 70 or older will have polyps. And this is increasing under the age of 55, so the screening guidelines have changed to start earlier. Men have a higher slightly risk than women. Blacks are also at higher risk. And people who are obese have a 20% increased risk of developing polyps and colon cancer. Also, family history. If you have family history, that increases your risk. About a third of patients who have colon cancer also have family history. And then there are also some inherited syndromes called Lynch and FAP, and also some medical conditions, inflammatory bowel disease, and even diabetes increases your risk for colon cancer. And then the last thing is take action. So we recommend screening most people at the age of 45. Again, average risk patients begin screening at age 45. This is a relatively new guideline over the past couple of years. We used to say 50, but it's dropped to 45 because there's a higher rate of polyps and cancer in younger ages. If you have a family history, then you would be screened sooner, 10 years younger than your closest relative or the age of 40, whichever's first. And then we continue to the age of 85 nowadays if you're relatively healthy and you've been screened, your screening is up to date. But if you have a shortened life expectancy, a terminal illness or less than 10 years of anticipated remaining life, then we don't, recommend continuing to screen. But it's important that you talk to your primary care provider to get a referral for colonoscopy and to take action. It's the most important thing. And so, I'm happy to talk further about this. Enjoy the conversation we're going to have. Feel free to contact us, to set up a colonoscopy or discuss as well. Thank you so much.
That was great, Doc. That was some great information shared. I learned a few things, and we'll get back to you with that. But I want to bring in another guy, and he probably has some questions or wants to basically talk about colon cancer and his involvement with that. And he's part of Westside Legends. Marvin Purry, can you welcome yourself in and talk?
Hello, everyone. Hope all is well. Usually when we're on having calls like this, we're usually joking around, but with this particular matter, this is no joking matter. Cancer is, bad word, and it's not discriminatory. Men, women, the one thing I will say that I was shocked at listening to this is it affects women as well as men. So I have been screened approximately 8 years ago. And this is one of those instances where the bark is worse than the bite, because you hear about the liquid, and I want to ask the doctor about the liquid. My primary doctor prescribed the liquid for me to drink 24 hours before I had the colonoscopy. Yeah, it does its job, clean you out. It gives a basis for the doctor to really scrutinize and check you out. Then the next day, went to the outpatient office and had some anesthesia, sleeping gas. Basically, they told me to count from 100 to 1 backwards. I was out by 96. So, but by the time I woke up, like Dr. Bratcher said, it was a nice nap. There was no ill effects, and the only thing is that you need someone to drive you home because you're still under the anesthesia. But as much as you hear about it, it's really a pleasant, necessary procedure that you should do. I am due to receive another procedure. I have to get to my primary and have this procedure done. So that's my experience with a colonoscopy. I'm going to have questions for the doctor later, but I'm gonna shoot it back to Tony so he can tell you his recent experience with a colonoscopy.
Thanks, Mark. So when we talked about this and setting this up, and we knew that this month was colon cancer, I said, you know what? I'm going to schedule my colonoscopy for this month. And I did it on Monday. So I'm recent, right? And Marv just mentioned it. The worst part about it is, and Marv will relate to this, we both enjoy eating, Doc. So We had to go 24 hours without eating. That was the worst part of the whole procedure.
Right.
Okay. And you ran to the bathroom a few times.
Mhm.
And my results came back right after, the doc put me out. I woke up, I had a great sleep. I didn't want to wake up. I'll be honest. I was in a really good sleep. And the doctor said, yes, Mr. Jackson, we had one polyp in there. It was benign. We removed it and you're good for another 10 years. And then he said the magic words, you can eat whatever you want to eat. I walked out of there happy as can be and feeling good. And I just want people to know it is very, very easy surgery. The prep is the only thing that there's a little stigma about, but for me, I had to do it. My grandmother died of colon cancer, was never screened. And it was a rough way for her to die. And she was loved by so many, it hurt all of us. So the thing we learned from there is get your colonoscopy, right? My mother just recently, 4 to 5 years ago, had part of her colon removed because she didn't get her colonoscopy done. So my generation and me said, I'm going to get my colonoscopy regularly. And I told my daughters that they need to get it at the age of 45. That's new information the doctor just shared with us. And I think the more you spread that information, the less people will have with colon cancer. So let's throw some questions at the doctor and see what happens. I had a couple people ask me, why do I have to take the fluid? I heard I could take 3 pills. How does the pills work versus the fluid?
So there's no prep that gives you just 3 pills, unfortunately. So the liquid has been the tried and true method for years, for decades, being able to cleanse the intestines very, very, very well. So the way that it works is that it goes through and it actually pulls fluid into the intestine and it helps it clean out very effectively. There's a newer preparation out now that does have a lot of pills, but there are a significant number, 12 to 24 pills roughly. You have to take a lot of fluid with it, and they're generally pretty good and effective. The problem is they're not covered by a lot of insurance plans, and they can be expensive. So, but the tried and true preparation is the big, large bowel preparation or large volume preparation that we give to really cleanse out the intestines. It's really the most important part, and everybody, fears it. They detest it. I just had my first colonoscopy back in November, and I was not looking forward to the prep either. It wasn't as bad as I thought it was going to be, so I can say that, but it's not fun. We'll just say the prep isn't fun, but it can be life-saving, and it shouldn't be something to be fearful of. And then especially once you get to the procedure, the day of the procedure, you're asleep, you have a great nap, and you wake up hungry and allowed to eat. So that's the best part.
Yes. And Doc, here's a follow-up to that. You said that everybody should have a colonoscopy. And I think this is a lot different than, breast cancer with women, and some men have it, but majority of the people don't need to do certain things. But for colon cancer, it's very important that everybody did this. It would really reduce the amount of colon cancer, which is the number 2, which that was surprising to me. Can you go over that a little bit? And it doesn't, not one age group, not one certain race, everyone should get a colonoscopy.
Right. Yeah, I think there's a misconception that, I only need a colonoscopy if I have known family history or symptoms. That's not true. Screening tests are done to try to prevent something from happening. So screening for colon cancer, we do it when you don't have any symptoms. We're doing this to look for those little tiny polyps. And, again, men and women both can develop polyps. 50% of people at the age of 70, all people will have polyps or have had polyps. So it's not insignificant. And we know if we remove the polyps before they turn cancerous, that prevents cancer from happening. So it's a no-brainer. So
Yeah, that's great information. Marv, I know you got a question for the doctor.
I have a question and a statement.
okay.
My question is, I'm a technical person. So when the procedure is actually done, there's a camera that's inserted to see where the polyps are.
Right.
Now, I guess my question is, and this is what I heard, does the camera double as like the instrument that removes the polyp?
Right. So we have these scopes, right? That's just a long tube with a little camera at the tip of it. And along the tube, there's a little channel in the shaft that we can put our instruments down. So if you think of it, the camera's at the very end of the scope, and the instruments come out through the end of the scope, and we can grab on it as the polyp is when we're looking at it. So the camera is looking at it as we take the polyp off, from our little instruments we can snake down the scope.
And my statement is, and this is my statement for everybody, this is the cheat sheet that I was going to use for Dr. Bratcher, but I couldn't use it because it is the Berkshire Eagle, Wednesday, March 9th. It is his article that was in the paper. And if you get a chance to read this article, you can use this, keep this as your cheat sheet. The article is very detailed, and it gives you fact versus myth, and it'll give you a great understanding of what this is all about. And it's an excellent article, Doctor. Thank you.
Right. I appreciate that. Yeah, it has some really good information. And, we just need to spread awareness and get people to understand that everybody needs a colonoscopy at the age of 45 or sooner. The procedure is easy. The prep may not be easy, but it's tolerable. And it can save your life. It really can.
And the thing that I want people to understand is it's worth doing, right? You don't want to deal with the other stuff. My mother had to have 10 inches of her colon removed, and she was in the hospital for a week. And it was her first time having a procedure done. And it was necessary to save her life, but it could have been prevented. And that's what this is all about, educating people and let them know that, listen, go get your colonoscopy. It's not that bad. I know a few people were teasing me about, getting it done and everything. But Doc, how long does it take? How long is the actual procedure? Is it, I felt like I would sleep for 5 minutes and it was done and over with. So I was like, geez, that was it. And I was on my way home.
Yeah, it's a pretty quick procedure. Once you're asleep, it takes anywhere from, 15 minutes to half hour, 45 minutes if you have a lot of polyps. But typically it's done within half an hour. So it's a pretty quick test. We generally ask patients to arrive about an hour ahead of time to get settled in and get an IV and, get all the documentation taken care of. Then they do the procedure. Then you have a recovery that takes about 15 to 20 minutes. And then you go home. Somebody that, like you had said, somebody to help take you home, because you do get anesthesia for the most part and you shouldn't drive after that. But it's a pretty quick test.
So when the doctor told me I had a benign polyp, I was really happy. What if it wasn't benign, and what's the procedures that follows up after that? And
so if the polyp is
a malignant,
if there's a cancer within the polyp, it depends on how deep that cancer is on the wall of the colon. So that slide that I showed had like the progression of polyps. As they start growing and turning to a cancer, they can start invading the wall of the colon. If it's still confined just within the polyp and you get the whole thing off, then you may not need anything else other than just a repeat colonoscopy in 3 to 6 months to make sure everything's gone, and then go back to more surveillance programs, less frequent. If it looks like it's going into the wall of the colon, then you would probably need other testing, a CAT scan to determine if there's been any spread outside the colon. And then we would refer you to see a surgeon to consider surgery to remove that area of the colon and confirm that it's all removed. If it looks like it's been invading and the CAT scan shows there's invasion, then some patients will get chemotherapy, before they would go on for, surgery or whatnot. But that's typically the process. But again, our goal, our hope is that everybody gets screened to prevent that. Getting these polyps off early can prevent all of it.
Yeah, and
It's also, sorry, one of the thing I wanted to mention also is that if you have symptoms also, don't ignore them, especially bleeding, new onset constipation, pencil thin stool. These things are gross to kind of talk about, but these are the things that can really that really scare us into, we need to investigate this further. We need to look into this. And even if you've had a colonoscopy done in the recent past and you develop these new symptoms, still talk to your doctor about it and see if you need to have a repeat test just to be certain.
Yeah. And the other thing is, it was nice because when I went for my colonoscopy, the best insurance is, and this is what you have to find out, it's preventative. So if it's preventative operation or procedure, there's no charge, out-of-pocket cost, which is another great reason why wouldn't you do it if it's not going to cost you any money?
Right.
And then, the other part of that is we can all do something different and make a major change if everybody just listens to the doctor and schedules their colonoscopy. So Marv, let's end up the conversation with the doctor. If you have any final questions or thoughts, please share them.
My final thought is basically, it's like everyone said, this is too easy. This is too easy not to do. Let's prevent this. Let's enjoy life. And like I said, I'm just gonna reinforce again, Wednesday, March 9th. The title is Fears, Myths About Colonoscopies Cause Needless Deaths. It is a must read. Matter of fact, I'm going to tell you that's in section B, the Berkshires. Now, for everyone who's looking at this, you guys know that this is the Berkshire Eagle. Please take the time and read it. Again, thank you, doctor, for coming on, and appreciate your time and appreciate your information.
My pleasure. Anytime. Thank you so much. And I appreciate, this platform to discuss such an important topic.
So, you got anything to wrap up?
Yeah, I just want to thank the doctor for spending some time and getting rid of the myths and basically giving the facts. Number there for BHS. Please call that number. Let them know that you're interested in getting screened and a colonoscopy scheduled. If you have insurance, it's not going to cost you anything. It's just going to take some time. And from the West Side to BHS, thank you, doctor, for sharing that information. And we really appreciate you.
Thank you so much. Have a good night.